Week 6, EMR. This is for the medicine corrections. There's 5 medicines. For each of the medicines, we do the same thing. We do the 7 rights, which are right medicine, right medication, right dose, right route, right patient, right indication, right date and time, and right documentation. And then we do the 3 checks. So we want to make sure that we check with the doctor's orders. That's 1. 2, we check that the medicine name is correct to the MAR. And 3, we check that the medication, we check at the time that we administer the medication before we close the drawer. And we want to make sure that the medicine matches the patient's name. And so then we go to the 5 medicines. So first we start off with Mr. Jones. His birthday is 1/1/1980. He's on ASA, aspirin. And he has headaches, and his vital signs were he had a little slight blood pressure, it wasn't major. It was 135/70. Otherwise, his vital signs were close to within normal. But again, ASA or aspirin is indicated for headaches. And the dosage that we want to give him is 325 milligrams 1 time a day per oral. Next, we want to give Mr. Jones, the same patient, the same birthday, rivastigmine. That's what's indicated to him, and that's indicated for dementia. His vital signs, again, were the same as before, just slightly high blood pressure, but everything else seemed to be within the normal range. This is rivastigmine, 1.5 milligrams daily, twice a day, per oral. Again, it's 1 in the day, 1 in the night, per oral. And that's for dementia. For Mr. Smith, number 3, the 3rd medicine, we give amlodipine. Amlodipine is for hypertension, is indicated for hypertension. His blood pressure was around 170/90 or 100. It ranged. It was a little bit high. It was high, definitely high. Other vital signs were within normal limits. Maybe the pulse rate was a little bit high, nearing the 90s, the hundreds. Beats per minute. The dosage for amlodipine is 5 milligrams 1 time a day per mouth. That's the route. And again, it's 1 per mouth. 1 per mouth per oral. And amlodipine is for hypertension, as we said before, for Mr. Smith. Again, Mr. Smith's birthday was 1980. I believe, and we checked his ID. We checked all their IDs, and again, Mr. Smith again, his birthday is 1980, 1/1/1980. We want to give him the 4th medicine, which is Augmentin ES extended tabs, and they're 400 milligrams for caplets. And we gave it to him today per oral. This is for respiratory tract infections. His vital signs, he was a little bit tachypnic. His O2 rate was above 22 breaths per minute, 24, 26. Otherwise, his vital signs were normal, more or less. And then finally, for Mr. Smith, the same birthday, the same patient, same ID. He was to be administered albuterol, a bronchodilator. That's 2 inhalations with an inhaler of some sort, of the albuterol inhaler or the bronchodilator. It's for every 4 to 6 hours. This is for wheezing. It's to take care of wheezing, and the treatment for asthma. It's not for pain. And again, his O2 was a little bit high. He was around 24 breaths per minute. Blood pressure was within the normal limits. The heart rate was within normal limits. Oxygen sat was below 94, 93, 92 percent. So those are the 5 medicines for the EMR for week 6. The corrections, they were given everything per the correctly per the provider's orders, and we went with the 7 rights and the 3 checks, and we made sure that their vitals, that the patient's vital signs were matching to what they need per medication. And that is the end of the EMR week 6. Thank you.